And here's our finale: cool down, stretch, rejuvenation, rehabilitation for the ankles. So when we have knee problems, we have hip problems, it can mean that our ankles are weak as well. So doesn't mean it is the problem, but the stronger our ankles are, the less pressure and the less work the knees have to do. So I love this. This stretch slash exercise has helped so many people. Plantar fasciitis, heel spurs, ankle popping. It's amazing to wake up the foot. So if you've worn shoes for most of your waking day, let's say you go to a 9-to-5 job, or you're sitting at a computer, or you do a lot of driving, wearing shoes will compress the joints in your foot and your toes, and it stops blood circulation, it stops lubrication for that joint. So we want to wake up the foot. How do we do that? We call this holding hands with the foot. So we take our right hand with our left foot, or you can do the opposite. What we want is the opposite hand to the opposite foot, okay? I'm not using the same side here. Take the palm of our hand and place it on the sole of the foot. So we call this holding hands with the foot because that's what it is. I'm going to take my pinky and I'm going to place it into the pinky groove of my toe. I'm going to go consecutively down the road. Ring finger, ring groove. Middle finger, middle toe groove. And pointer finger, big toe groove. Whoa, whoa, whoa. I haven't done this in a while, and I'm feeling the pain. So this will wake up. This might make your eyes water at first. You might not be able to wiggle your fingers all the way down into the toe grooves because you're really spacing out those toes. So we know we have carpals in the forearms, right? Carpal tunnel syndrome. There are also carpals in the foot up the shin. We're waking these up as we rotate the ankle. So I'm holding my foot any way I can, whether it's here, whether it's here. If I want to do it on a chair, that's fine. But I'm just rotating my ankle and sitting up nice and tall. I don't want to crunch my diaphragm if I can be aware of that, right? These are all extra layers. Now, as I feel like this is getting a little less pain, the pain is dissipating a little bit here. Now I'm going to start flexing my toes back and rolling them forward. So I'm not just circling my ankle, I'm actually flexing my toes backwards. As I rotate around, as I come forward, I'm going to rotate them in. So they're curling in and around and in. And I'm really giving my foot a massage here. I'm pushing into the arch, I'm rolling around, and then I'm going to reverse the direction. I'm warning you, if you try and do all these things at first, it might be too painful. So listen to your body will give you signals. I've seen people just be thankful, first of all, you can reach your foot. There are some people that can't get into this position, right? And if you're one of them, you can do this on a chair where it's easier, or you can lift this leg up higher so that you're closer to your foot. We're thankful here. We just go step by step by step by step. And if you do this every day, every other day, and you're breathing deep, you can do this in bed when you're laying down, right? That should be easier to reach your foot. Make sure you do the other direction because your body naturally picks the easiest way. So we always want to go and do the other side first as well, right? Breathing deeply, and I'm telling you, you are prepping your foot. And then the seal. Foot, point, and flexes. That's really hard to say. We want to lay down, extend this leg, and flex this foot so it's not flailing out to the side. Once again, we're pulling in one leg, and we're rotating that ankle. So I call these ankle circles or foot circles. These are not knee circles, okay? And when the body gets tired, you will notice that that's exactly what it wants to do. It wants to take the motion to the knee. But like I said before, if our ankles are stronger, it's going to take a lot of pressure off of our knee joint. So I'm only trying to isolate the movement at the ankle. And you'll start feeling the fire run up your shin, run up the tibia bone. So we're going to try and do at least 10 circles and then reverse the direction. keeping the shin as still as you can. You'll hear it popping and grinding sometimes. That just means we're working the kinks out, okay? So 10 on each direction, in each direction. Then when you're done, we're gonna go pointing and flexing, pointing and flexing, making sure that the shin is not the thing that's moving. It's the ankle that's doing all of the work. Once you can do 10 of these, I want you to kick it up to 20, and it will burn like fire. But the fire means weakness, and we want to really, really work that out of the body. So when I'm doing this, I'm really pulling my toes in. When I'm pointing, I'm really using the arch of my foot to point. So you've got 3 directions. Circles one way, circles the other way, point and flexes, okay? Congratulations. When you get up, here's another tip. It's a fun tip. Getting up. Can you get it to where, practice, someday you can get up with no hands? Might not happen the first time. You might not need to use one hand. You might need to use 2. But the more you practice, the better it will, easier it will get. Thank you so much for coming along with me. I'm so proud of you.